My first impression of Peoria was that it was a small town and that there wasn't that much to do. But once I got here, everyone was so warm, so friendly.
Driving through Peoria for my interview, I was really amazed and impressed.
It's a smaller city, but I think that sometimes it actually feels bigger than it really is.
Peoria to me is just a great place to live. It's really easy to get around. You don't have to fight traffic after a long day of being on call, and it's really affordable.
There are a lot of things I really love about Peoria.
As a family, we love to go out and go to orchards. We love to come to the Riverfront Museum. We love to go to the Children's Museum here. We love to go biking.
So I love how easy it is to get around. I love the convenience of the community. There's affordable housing.
I can truly say it's the best of both worlds. You have a lot of the big city amenities without the traffic, which is awesome.
We wanted an international airport and a Costco, and it had both of those.
The idea of being able to run to the airport, park for free, and be able to fly anywhere I want to fly, I really love that about this community.
Hi, my name is Lena Kandari. I'm the Fellowship Director for the Pediatric Hospital Medicine Fellowship here at the University of Illinois College of Medicine in Peoria, the OSF Healthcare Children's Hospital of Illinois. We are so excited that you are interested in finding out a little bit more about this program that we absolutely love.
Hi, my name is Nadia Sheikh. I'm one of the pediatric hospitalists, and I'm also the Associate Program Director for the Fellowship of Hospital Medicine at the Children's Hospital of Illinois. We are very excited to have you all here. This is a new program. It got newly accredited just this last year. This is a program that has been built with a core faculty who's majorly all certified in pediatric hospital medicine. We are coming in excitedly to be a part of the PHM fellowship programs to provide you what you really want to learn in the next 2 years when you come here for fellowship.
The Children's Hospital of Illinois is a hospital within a hospital within the OSF healthcare system. We are the only children's hospital in central Illinois and the third best children's hospital in the state of Illinois. Your training here will encompass a wide variety of patient types, and I think one of the greatest things about our program is the exposure to our intermediate unit. We have more than 20 beds in our general peds unit. We have a hem-onc unit. We have a pediatric intermediate care unit that is staffed both by the ICU and the hospice team, as well as 16 ICU beds. Often their patients come to us as step-down. We have a robust congenital heart center, and we have just about every specialty you can think of. We have a large division of 21 pediatric hospital medicine faculty members, 9 of which will be core faculty for our fellowship. Our faculty is committed to education, excited to have fellows to teach and mentor, and really we're looking for people who want to make this experience their own. We offer a wide variety of pathology here in central Illinois with great exposure both to bread and butter pediatrics as well as really rare things that honestly are 1 in a million in the textbook.
I think I would just give you an example, which I always tell my residents, that I train in a big city, and when I came here, I saw that everything that I was seeing every 5-6 months, I would see them every month or so, because they just come over here. They come on to us. We have all the specialties available so that they can get trained on, they can get those experiences. So this way, it provides a very cumulative and a very complete experience when they get out of here, and it's very much evidence-based training.
Our program is new this year. We're newly ACGME accredited, one of the 50-plus programs now that are accredited throughout the country. We offer a 2-year fellowship with a focus on excellent clinical care, QI, clinical pathways, and the opportunity to pursue a simulation fellowship while you're here at our award-winning Jump Simulation Center located on campus with us.
JUMP is one of those state-of-the-art institutions in the nation that are actually providing a 1 to 2 year simulation fellowship. And when the fellows are going to come over here, they are going to be given this opportunity to choose this as part of their training as an additional perk that they can do while they're training in pediatric hospital medicine. So when they get out of here and they want to go into an academic center or at the community center and then develop that stimulation over there, they will have those skills to do.
The hospital service is also extensively involved on our sedation team, and so we get the exposure to a wide variety of patients on that service also. We use a number of agents in order to induce sedation and a number of procedures, including IV placement all the way through Botox, liver biopsies, and kidney biopsies. It's really a fantastic opportunity to practice some of your procedural skills, get comfortable with deep sedation, moderate sedation, and using multiple therapeutic agents in order to make a child comfortable to be able to tolerate the procedure they need.
We clearly understand that pediatric hospital medicine is not only a clinical fellowship. It is an academic fellowship in which we want you to learn not only to become a clinically sound physician, but also to understand how the evidence is behind all the research and how you initiate or conduct quality improvement projects. So here at the Children's Hospital of Illinois, we are doing national level collaborative efforts. Are you doing all those QI projects like the VIP project and the Revise project or SOFI? And residents and fellows get the opportunity to be a part of that. They also get the opportunity to really hone their skills in clinical research. So that's the other thing I wanted to mention, that we do understand that they have to become leaders when they get out of here. So we work on their leadership skills, we work on their research pathways, and we also make sure that they understand how to conduct QI initiatives as they go out and be physicians on their own and want to improve care of hospital pediatrics.
If you want a place to train where you're going to get fantastic clinical exposure, faculty who really cares about your goals and where you want to go in your fellowship and what you want to learn, and an exposure to process improvement, QI, simulation, and education training across the breadth of UGME and GME, this is really the place for you.
The fellows will get the opportunity to get that mentorship so that they can be guided to find their niche, and that's our goal, that they can, if they're feeling, they'll always feel that they're very well supported in terms of guidance. The other part comes, of course, is like clinical medicine, clinical care of patients, which is sometimes very cumbersome. So the good part is that every single time when they're going to be working, they are going to have some kind of a supervising attending who will be helping them out through making decisions. It's not that they're not going to be having their autonomy. They will have their autonomy, but they will also have this opportunity to ask for help whenever they need. So it's going to be that kind of a group that we're going to be taking on forward for the fellows.
One of the things I love most about Peoria and our program here is the opportunity that I've had to see it grow. I was a resident here, completing both my residency and my chief residency here in Peoria, and then stayed on as hospital medicine faculty, and now I'm lucky enough to be able to run the fellowship. Our faculty here, our facilities here have expanded tremendously in the last 10 years, and we're very fortunate to have people who are committed to the care of children here and the education of all of our learners.
So I moved on to Peoria from New York City. I trained back in Mount Sinai, and then I moved over here. It was a pleasant surprise to be in Peoria. I wasn't expecting to see such an outstanding hospital, and honestly, JUMP mesmerized me. I think truly when I came here, I was thinking to find a program that gives me the opportunity to grow. And I find that this is where it was. Like, it had everything that I asked for. I could really individualize my personal experience and my CV the way I wanted it to be.
I think the great thing about the Pediatric Hospital Medicine Fellowship is you can really make it what you need it to be. And across the country, you'll get a ton of different options for how you want to train, where you want to train, and the focus for what you're looking for. Fellowship offers you the opportunity to grow in the skills you have and develop skills that you didn't quite get in residency and are looking to become not only just proficient, but obtain mastery in. We offer our fellows the opportunity to be mentored by a group of physicians who are committed to education, but also to seeing you grow as a physician and as a person. We would love to be able to help you develop your clinical acumen, refine your QI skills, really bring out that teacher in you with the opportunities we have from M1s all the way through our multiple residency programs, but also shape you as a physician and how you want to be in your professional life. Fellowship here in Peoria at the Children's Hospital of Illinois will give you the skills that you need to be an excellent clinician, will give you the tools that you need to develop research projects, to work on clinical guidelines, but it'll give you the opportunity to reflect and really become the physician that you want to be, with a variety of people here to serve both as mentors and as guides.
Hi, my name is Julia Samanda, and I'm from Wausau, Wisconsin.
From Markham, Ontario, Canada.
From Joliet, Illinois.
From Rockland, California.
From Kansas City, Missouri.
From British Columbia, Canada.
From Rushville, Indiana.
And I'm from Chico, California.
So I knew that there was something special about this program immediately.
I loved my time in Peoria as a resident and as a medical student.
Some things I like about our department is how supportive our faculty are.
It's a really tight-knit community.
There's lots of benefits to having a 24-hour open cafeteria. It's also nice having a little group of 10 people to call your family as you progress through these 3 years. Everybody has each other's backs, and that goes a long way when things look a little bit difficult.
I can honestly say it was an incredible training experience there.
I really wanted something that was family friendly and well-rounded.
You have an incredibly supportive learning environment, and the volume of patients that you see is incredible.
Here's one of the benefits of coming to Peoria is you get to put in some work with Life Flight.
I really encourage you to look into this program because there are so many wonderful benefits and you'll have a really great experience if you train here.
Hope to see you in Peoria.